Welcome, folks. This is House Corrections and Institutions Committee. It's Tuesday, whatever day it is today, Tuesday, May 20th. We're going to be hearing testimony this afternoon from DOC as well as our state employees union about correctional officers recruitment and retention. So we'll start with DOC and Isaac. I know you've brought some folks with you, so what is your plan for who goes first?
Tanya Barber is gonna step into the hot seat.
Great, welcome, Tanya.
Thank you. Oh, this is the hot seat.
I don't know if you've been here before.
I have not.
We'll be okay with you. We'll be fine. So Tanya, if you could introduce yourself for the record, and we do have a document here posted to our webpage as well.
My name is Tanya Barber, and I'm Deputy Director of the Office of Professional Standard and Compliance. I'm oversee development and wellness, which does include recruitment and retention, our peer support team, and anything else that falls under recruitment and retention.
You're within the Department of Corrections.
Yes, for DOC under the Office of Professional Standard and Compliance.
Welcome.
I can't see.
Right, you can see behind me.
Right, so I have some slides in front of me, so I just apologize for that.
Isaac is very good in following.
Yes.
Moving along.
So we're just gonna, we have a slide up here that focuses on our strategic plan and wanted to bring attention to that because wanted you to just to see that staff and staffing plays a key role in our strategic planning because without building our workforce, we will struggle to work and achieve the roadmap that we've designed for ourselves through 2030. That's mission focused. And so we just wanted to, and I think that, I think you may have seen this slide before, something to this effect before, but staff and staffing is like I said, it's key to the work that we do in our mission, vision, values connected to our strategic plan. Let's see, our next slide. I apologize. This slide, I think you've seen this before as well. The commissioner, I think, has shared this. And I'll just do a quick overview. It talks about our operations, staff deployment, which we've looked at redesigning our schedules to maximize the time away from the facilities, hospital coverage team, the data that we worked on that talks about we track our staff through stay interviews, transfer exit interviews, the staff surveys, our mental health. We have our peer support team, our mental health clinician that staff have available, is available to staff, our benefits that we look at, the CCV program, which I also oversee. We have a grant position that works for me, so I oversee that as well, offering that to staff and family, which has been pretty successful so far. Our modernization, the strategic plan updates our vision, mission, and values with our WCIX media investments, the financial investments. So this, like I said, I think this is something that's been shared before, but just wanted to provide a quick overview of our initiatives that we're working on these last 3 years.
I have questions on the operations piece. Is that for just within correctional facilities that you're looking at staff deployment data, mental health benefits, internal organization? Is that just within our correctional facilities, the staffing within that?
That includes all DOC, our field, our probation parole offices, our central office, and our facilities. It encompasses all of that.
And then the pyramid, does that break it down in terms of how much investment goes to 1, 2, and 3? So that 3, you're putting 30 million towards specific pay scales, retirement, that piece, or is it 30 million for the whole pyramid?
I'm going to refer to Isaac on the financial piece.
As the policy director for the department, yes, that's just the financial investment in the pay benefits, that piece. And that's above the contract rate. That's through side letters.
Of the contract
over the
rate.
last several years. So this is really just a schematic. I think the commissioner, again, to Tanya's point, has shared with the committee And we're gonna go through all these in greater detail in subsequent slides and kind of break this out. But really just kind of show the base of the pyramid is the kind of financial investment. And then built on top of that are all of these operational investments that we've made, including the schedule, looking at data, the CCV program, and then kind of on the top of that being how we're reorienting the department.
So the CAX media investments, those are those little 1-minute DOC clips that you see during the WCAX Channel 3 news.
And we've got slides on that and we're gonna page through those, so. Just to-
What's the cost of doing those? I mean, you have to pay CAX for that, correct?
I don't have those figures. I know we've been talking about it lately. I don't
Yeah,
know.
it's a multi-year contract, I believe. Actually, I'd be hesitant to speak without looking, but I can do that quickly.
I'd like to have the actual numbers.
Are you finding those media investments, that little 1-minute DOC minute at CAX can you target that that's bringing folks in, that it's achieving the recruitment goals?
Yes, and we have a couple slides on that further down in the
Yeah.
presentation, so we can get into that.
Maybe let's go to the next slide. And if you want to talk a little bit about the history of DSC.
Yeah, that might be helpful. So the Office of Professional Standards was created in 2021. It includes recruitment retention in our training, which is our academy. So all of our training comes out of our office. Our PREA, the prison rape elimination, is also underneath our umbrella. I have a dedicated recruitment and retention team, so it's we, that works under me as well. And that covers, again, the field, the facilities, the central office. So we focus on recruitment, for example, when someone's posting a position, it doesn't matter where it is, we assist with that, if they need it. So we have a team that's just dedicated to recruitment and retention and wellness. I have 3 recruitment and retention coordinators. In fact, I brought one. Steve Belisle is with me here today. I have 2 others, and we actually have a supervisor position that I'm currently looking to fill because the person who was previously in that was promoted. But I also there's a peer support coordinator that just focuses on peer support. And then we also have through our CCV grant position, we have a liaison who works specifically with staff, assisting them with their CCV classes that works under my team as well.
We probably should have asked these basic questions a long time ago. How many correctional officers are there throughout the system? How many field PMP officers are there?
I don't know the
They
field
should-
numbers, but I can give you facility deployable staff members as of last week. Chittenden is at 49. Staff members, Marble Valley is at 43. St. John's Bear is at 59. Northern State Newport is at 66. Northwest State Correctional Facility is at 71. And Southern State is at 67 staff members deployable.
Those are FTE equivalents or actual people?
That's just deployable, people who are eligible to work or are working. That doesn't include people on long-term leave due to medical reasons or
Only 3 months.
So those are folks that are working, able to work. So
working or
So just for some perspective, and I'm only familiar with Springfield, I'm not familiar with the others, but I know for Springfield to be fully staffed, you need at least 100 to 110. And you're at 69. That's the boiler, yeah.
yeah, I believe one of our facility staff experience supervisor that outgoing Michael Monday has mentioned that more than 100 staff would be kind of like a base optimal functioning.
Just, and I don't know what the optimum employment numbers are for the other facilities.
I don't know.
Yeah, I didn't
about
bring
it.
that data.
My experience is with Chittenden and Northwest though, but I would hate to guess and be incorrect.
So in Springfield, there's 350 folks, basically incarcerated. There's 69 staff that are working. Newport has about 425 incarcerated folks. And how much staff?
Newport's at 6 deployable staff members.
66. In St. Albans, there's about 250, I believe, incarcerated.
Yes. There's currently 71.
Yeah, so your Newport and Springfield, for the amount of folks who are incarcerated, the staff to inmate ratio is high. But the other piece that's different, Newport and Springfield are designed a little differently than St. Albans, so you might not need as much staff either. Balance.
Sightline.
Joe, you had your hand up?
No, I think what you were speaking about came close to the crux of my comments, so good.
So your older facilities, the way they're designed, as Isaac just said, you have a lot of different living units that are not, they're more linear. They're not built on top of each other per se. You have line of sight issues. You got a lot of corners. And your newer facilities, if you design it more open, then you don't run into those particular obstacles and you can have less staff.
For example, Women's Reentry Center in Maine has, I believe, one staff member at the podium for about 100 4 different units that you drive upon. So as we look to build a women's correctional facility, a new one that is, again, an investment in staff and incarcerated folks, better conditions there. We would build that with sight lines similar to the one in Maine. I'm not sure about the final numbers, but so that we would reduce the number of staff that we need to have on, so we can drive down some of that mandatory overtime as much as possible.
Questions? Folks have?
I'm assuming you don't have like what I'd call an org chart that says, here's all the facilities, here's the people and what the openings are. You don't have any kind of a summary like that, so we can get a.
There is an org chart that's on our website that's accessible publicly. I'm not sure whether it has the vacant positions, but it does have like all the positions that are available on each work site as well as folks that are working in them.
Okay.
Stephen, you're gonna come up and testify, right? Or you're just here for more backup? Okay.
It's a twofer.
It's a twofer. Well, I'm gonna ask this, and again, I hate to do this, but I'm focusing on the facility where is the Springfield, where you said there were 69 actual boots on the ground, but that doesn't include folks that may be out on leave for a variety of reasons. How many folks are out on leave, employed at that facility, but at this point not able to work there?
I didn't bring that number in with me.
We can track it down for you.
Madam Chair, I've got
Could you identify yourself?
yes, Jess King Moore. I am the Research and Data Unit Director for DOC. And I can also introduce my colleague that I brought here today.
Yeah. Hey, Williford Rensa, I'm a corrections analyst with the Department of Corrections.
So we just pulled up data while everyone was chatting because we have it readily accessible. We kind of.
We brought our data
What
team.
happened?
So can you send that to Phil so that we can
Yes.
get a copy of it right now so we can actually look at it?
Yeah, I put, Representative, I put copies of our staffing dashboard on your desk.
Yes, I saw that, but the rest of the committee would like to see it. This is back to December 30th, 2024. And is it back to 2024?
I'm gonna let, yes. Yeah.
So the staff dashboard that you provided PDF or printouts of, that one's updated once a year. And the reason why is it's coming from DHR and it's a lift for them as well. So we've collaborated with the Department of Human Resources to receive identifiable data once a year. And then we get that every like January. And then Kayla's actually the lead on updating that dashboard and gets it usually posted online by February. It does show trends over time, but it's not as timely. We also receive regular information on position info, which is pretty simply where people are assigned to work and their name, their job title, and if there's a vacancy in the position, the name is vacant. So it's really easy for us to analyze and consistently look at vacancies. What that doesn't show us is long-term leave, which we do get some of that separately. But what we have started doing is my team's partnered with operations to have the facilities twice a day, so once every shift, report out on their deployable staff numbers, who's out on long-term leave, how many people are total employed at that time, how many are attending the academy, or they're called gap hires, which basically just means they've been hired and they're waiting for the next academy. So what they can do is limited because they need that security training, but they can still help out in the facility so that we can we take all of that information in to know the pulse of the facility on that given day. Because as we know with vacancy numbers, we can't hire positions above and beyond how many are allocated, but there are people who go out on leave, and that's going to impact facility operations. So we actually have both of those data available that I just pulled up. It just depends on what you guys want to hear now, and I can always send like screenshots or
So
something.
can you go back to my question in
Yes.
terms of Springfield?
Yes.
So it's 69 actual bodies that can show up for work, but how many folks are really there employed?
So
Correctional officers.
143 positions and only 29 positions are vacant.
But 143 includes superintendent supervisors. It's not just correctional officers.
Anybody who's assigned to the facility, we can go down to just COs because that's the number.
Right, so the 69 were COs, correct?
Corrections officers, I think facility shift supervisors as well. Not including chief security, assistant superintendent.
Of the 143, we actually have half the people physically there in the building.
Well, one second.
I think that's total, and then COs, the deployable and the.
Yes.
But the total staffing of the facility is 143. The 69 is supervisors and COs. So you're barely at half.
So we have 109 CO positions with 27 vacancies, so that's 82 current COs hired. But according to Southern, for total deployable, and this is the COs and CFSSs, so 1 second. I can do a good comparison here. They have COs and CFSSs, which is their shift supervisors. They had reported 67 this morning, so a couple less deployable than what they just said.
The numbers I gave were from last week.
But if we include CFSSs, which is the shift supervisors, oh yeah, you did that right, never, sorry. That 109 includes them. So 109 security staff, 67 deployable, but only 27 vacancies. So we do have people out on long term.
As of when?
Last night.
The chair, if I may, because I know we're gonna get more into this, and I don't want to get too sucked down into the wormhole data. Just 2 quick points. One, I think as we talked about last week, any allegation of misconduct is immediately referred to DHR for any reason. And again, that can result in RFD. I think Representative Casey referenced, there's media about that, and that's why we saw that big upswing in folks who are out on RFD, a pending investigation. I think it's
RFD being
relief from duty. And I think the average, from that article, was maybe like 6 weeks. I'm not sure, something like that. So it can be a lengthy period of time if someone is out of the facility. And the other piece I just point out is that all of this functionality, I think, is new for the department. I mean, Jess's team is a new, relative to the last few years, and we're able to actually do this, query this data, have this available for you. Otherwise, I think we'd have to request all of this from DHR directly. So we've really focused a lot, and as you'll see as we go through this, we invested a lot in being able to better understand our data.
And when did that start? How long ago did you start gathering and this data?
Defer to Jeff.
Yeah, so I started the DOC almost 6 years ago, but it was just me. And so they just started kind of doing more data analytics. Before then, there was somebody in my role, but it was more of, if you guys are familiar with the facts and figures report, that was pretty much that person's duty, right? Like every year, all they did was do the facts and figures report and public records requests related to data. And it turned into, under Commissioner Demmel, an entire unit, the research and data unit. And so we have 3 corrections analysts and me as part of the research and data unit. We started providing like an executive summary that included staffing levels to the commissioner, I would say, what, a year and a half ago, 2 years ago, maybe?
Yeah, a couple years ago.
And like, for instance, this site scheduling and vacancy dashboard where the facilities report that information to us twice a day, so once a shift. That started officially in like June of 24. We did some version of it before, but that was when it really took off. So all of this is relatively new. But it's our way of getting a pulse on the facilities and really tackling this staffing crisis.
Mary and then Con?
You said that the department was dedicated specifically to get this information. And yet when we're asking for information, rarely are we able to get the information we've requested. Do you, because I asked for this as a number of months ago, when you're having really challenging times with staffing, and you're understaffed, we asked for to show some data on how that's dealt with, but what the numbers are in up and downs of what your who's in and who's out for the day, and how people were put in place so that the facility is safe, not only for the correctional officers, but also for the folks who are incarcerated. And we've never, to this day, and I don't know if this has some of that in what was just given me today, but how quick can these simple little requests we're having be printed out if we have a dedicated department? Or I don't even know if you were ever asked.
I know Travis, I think weekly sends you guys the site scheduling and vacancy. Is that true?
No.
I know that's what he mentioned. Okay. So I guess it did not make its way to my team because every time it does, we've provided you guys with data. But we can easily give you guys the vacancy and scheduling dashboard. I will say, like, as far as the public nature of some of the numbers, I know some of this stuff we usually don't publish just because, you know, it gets very in the weeds and like counts of like one and stuff, and I usually don't put staff stuff out there if it's a count of one for their
Well,
own.
we don't want to get in the weeds. We
Yeah.
were wanting to see some windows of where challenges were, and we were hearing that there were some significant times where staffing was not at a good level. So we were wanting to see the ups and downs of that. It wasn't, weekly or daily type reports, but what are we doing? And I was assured that we were going to get it, and yet we never got anything. So is it the message that didn't go to someone, or it went, wasn't accomplished?
I did put that report on your desk.
Right, this morning, and I asked for these reports like 3 months
I
ago.
also gave 2 several weeks ago.
It's also published online, that dashboard that
Yes.
we try to whatever we can publish online that would not provide identifiable information, we do. Like, my team really pushes to put everything we can online because we know that, like, typically transparency wasn't always something that the state was very good at. So we try to do that as much as we can. It's just the more sensitive things like the site scheduling and vacancy is more of an internal report for us to get a pulse on the facility, and the numbers can be very low. So we don't put that online at this time.
Yeah, I was wondering, we had a good presentation from, and I'm spacing on her name. She was a doctor associated with Prim there.
Yeah.
I think she was out of Maryland.
Dr. Carter?
Yeah, that's right. That's right. And she had said something I never thought of, but like, I think maybe it is in Maryland. Have we considered looking at like high school tech programs to sort of embed like a vocational program for correctional officers? Maybe even paired with like law enforcement, since we're struggling recruiting some of those at the local level. So has that been something we'd looked at all?
Yes, we are actually involved with several tech centers. The coordinators work locally with them, and we're actually presenting some trainings that they've asked for us to adjust so we can present it to them. And we're bringing in folks to present like a DOC. This is kind of who we are type of thing to local tech centers. We have an internship program that we're also working on, that we bring interns in.
The tech center involvement has mostly been the de-escalation kind of course that we run through with interested students and staff. It kind of gives an abbreviated version of our advanced communications technique, which is verbal de-escalation skills and stuff like that we teach at the academy. So we have a point person on that who's also